Hi. So we have looked at the health consideration of the newborn and infant population, and today we're going to start looking at the remainder of the pediatric population. So today we are specifically going to discuss toddlers. Always a really fun stage, right? So what are we looking at with toddlers? I'm blocking some, so let me move myself. There we go. So when we're looking at toddlers, we're considering the terrible twos. Their ages are from 1 to 3. It's an incredibly intense period of environmental exploration and emotional development. We're seeing lots of temper tantrums and negativism with some of our little guys and girls. They're searching for autonomy during this time, which leads to those temper tantrums and whatnot. And we want to be cognizant of the fact that the developmental stages that they hit are going to impact their intellectual growth as well. So when we're looking at growth and development, we're going to take a closer look at the biological development, the psychosocial development, the cognitive development, spiritual development, and then in table 32-1, there's just a fabulous table that goes over everything for you, so you can really visualize the various things for what toddlers are going through. So when we're looking at biological development, we're looking at a beginning of some proportional changes. So their weight gain is going to slow to about 4 to 6 pounds per year. By 2.5, their birth weight should have quadrupled. So if you think about a 6-pound baby or even a 7-pound baby, we're going from 6 to 7 pounds up to, between 25 and 30 something pounds at this age, those 2.5-year-olds. Their height is going to increase about 3 inches per year during this time, that time from 1 to 3. And when you go to the 2-year checkup, or when parents go to their 2-year checkup, we can let them know that more likely than not, their child will be about twice the height that they are at 2. I remember when I took my middle child to her 2-year checkup, they told me she was going to be 5'2", and I thought they were crazy because my husband's 6 foot, I'm 5'7", so I'm thinking there's very little chance that we produce a child who's only going to be 5'2". However, she is significantly shorter than her sister, who is older, and her brother's catching up to her, so maybe she will be 5'2". There might be something to that. These little ones are going to start to look elongated. They start to lose some of that baby fat, and their legs get longer. Their trunk kind of stays the same. And their growth, when looked at a growth curve, it's going to look more step-like rather than the standard curve that we see with the newborn growth. And during this time period, also, we're going to see that fontanelle change. So the anterior fontanelle should be closed by about 18 months. Somewhere between 12 and 18 months, that fontanelle is going to close. With their sensory changes, we're looking at their eyesight. Their eyesight is 20/40 is an acceptable eyesight, which is a huge acuity change from that newborn period that you remember they can only see from about the breast to the mom's face. So they're now at 20/40 vision, and everything else starts to integrate with one another. So all of their senses are very developed at this time, and they're not only going to look at something. So if we use a block as an example, a toddler might pick up a block. They're going to look at it. They might lick it. They might smell it. They're going to shake it to see if it makes any noise or if it rattles. They're going to touch it, like feel it. So they're going to start to integrate all of their senses into the exploration of their environment. You can imagine what lovely things that can lead to if we're picking up and putting everything in our mouths, right? Then this time they also become pretty picky eaters because they start to realize that they like things that are bland. And so if something is green in color and smells funny, they're not going to want to eat it. So they start to develop that sense of taste and taste preferences for sweet things and bland things, most likely. If we continue to offer foods, though, eventually that will progress past. So there's an education point for our parents. We don't want them to give up on offering the variety of foods, because the toddlers, that's just how they're just picky eaters at this point. But we need to keep offering it so that they can move past the kind of the sensual fear of what it is that they're looking at to eat. As for the maturation of their systems, most physiological systems are relatively mature by the end of their toddlerhood. So we're seeing the respiratory system, the GI system, which is, we talked about with those newborns and the babies, it's really immature. These things are all mature by the end of toddlerhood. One aspect that we do see complications in is the ears. So the ear canal is still pretty small and straight. And so we see a lot of ear infections that can build up. The adenoids and the tonsils are also and more enlarged. Remember that period of lymph enlargement that we talked about. And so that is going to also block the drainage through that ear canal, so can contribute to ear infections as well. They're able to regulate their body temperature much better than the infants. So they'll be able to adequately their bodies will be able to help warm and cool, and then they'll be able to adequately communicate whether they are hot or cold. And their stomachs progress to being able to handle the quantity needed to eat 3 meals a day with a few snacks in between. So going from that newborn who has to eat every 2 hours because their tummy is so small, remember, size of the marble is what the newborn is born with, to a toddler whose stomach can handle the size of a meal needed to sustain themselves if they're eating 3 meals a day. We see the point of voluntary elimination. So toddlers start to develop that sense of they need to go, and they're able to identify that that is a sensation they're having, and they're able to stop it. So around 18 to 24 months is when they start to identify that, and they'll start to show signs of being ready for toilet training. And we'll talk about that a little bit later in the lecture. They start to have more predictable sleep-wake cycles, so we can count on them more to sleep through the night, which is great for parents. And their mood cycles are a little bit better. So although we are having those tantrums because of the autonomy, we're not having the ups and downs of the moods. They're far more predictable. And then we just always want that interaction. So when the brain's developing, it needs interaction with people and emotional connection to be able to adequately develop. So we want the parents sitting and playing with their child. We want them talking to them, and that's how that child's going to learn. Reading to them is perfect because you're snuggling in with the child, you're reading them a book so they get to see the words, and it's your voice who's talking to them. So we want to discourage the lots of screen time. Some screen time is okay, but we want to discourage lots of screen time and have those bonding interactions so that we can have that optimal brain development. For their gross and fine motor skills, this is the period of time where the babies start to learn to walk. So toddlers around 11 or 12 months, or sometimes even earlier, can start to walk, which changes not only their environment, but also their parents' environment drastically, because their capability to get places is so different when they start having that ability of locomotion. Their coordination is developing. We have a lot more fine motor skills that are continuing to develop. By 18 months, a toddler should be able to throw a ball. And, this allows for endless possibilities for exploration and investigation, and also hazards, because they're able to open those cupboards now. They're able to undo a cap, potentially, that's on some cleaning fluids or medications. So environmental control to keep the toddler safe is so important at this time. We need to be educating parents to put their cleaning supplies and medications high up in a locked cabinet to where that toddler can't get it. I'll never forget one day where I left my 2-year-old for literally a minute, maybe, just to go to the bathroom, and she was sitting in the living room playing, doing a puzzle. So she's engaged, I can go to the bathroom. And I come back out, and that little stinker had climbed up onto the cabinets on top of the microwave and was reaching up on top of the refrigerator to get the basket of candy. So they are able to do a lot. We cannot discount their abilities at this age. So moving on to psychosocial development. When we're looking at psychosocial development, we're gonna consider Erikson's shame versus doubt. So the toddlers are trying to develop autonomy and independence during this time, and being able to achieve tasks on their own is paramount to their development at this time. Now, that obviously has to be done within reason because they don't have those skills to achieve all tasks independently, obviously, but we want to give them a safe environment where they're able to try at least. They use negative responses and negativism as an expression of their independence. So a lot of the time when we ask a toddler, will you pick up your socks? Their initial response is no. My little guy, all the time, never, and says it just like that. And 5 seconds later is doing exactly what I asked him to do. So it's their way of expressing their independence. And it can be very frustrating for parents, especially if they don't know that that's an expected outcome. So again, we're onto that education and communication with parents so that they understand what this time period is about for these children. We want the toddlers to have some sort of ritual. They like routine, and it gives them a sense of comfort, and it really allows them then to go outside and to explore their environment a little bit more. If they know, okay, if X then Y, then they can kind of manipulate that a little bit, which is great for them at this time. They're going to have a lot of struggles between the autonomy and the dependence, because toddlers are still very dependent upon their parents, obviously, but they want that autonomy. So it's a struggle for them internally, and it's a struggle for the parents to find the right balance of letting them play a little bit and develop that independence, but also providing their needs. We obviously need to provide adequately for them. So finding that balance is key. And remember, toddlers are still very egocentric, so they can't think outside themselves, and they can only view it from their own perspective. It's hard for them to see another person's perspective or another person's point of view. As for punishment for the toddlers, it's better to reward good behavior than to punish bad behavior. They'll recognize that they're getting rewarded for that good behavior, and maybe a simple timeout is all that's needed for the bad behavior. And they'll start to want to do the behaviors that are rewarded because they really enjoy that reward, and they really enjoy that sense of pride they get when they're rewarded and told they did a good job and things of that nature. So this is the time to really develop that positive reinforcement and diminish the negative reinforcement. They'll start to really see themselves as the parents during this time as well. So they start to realize that they are their own individual. And then the other thing is, by about 3, there is a gender identity that has been established. It starts earlier. They start to distinguish between mom and dad and the difference between boys and girls earlier on. But by about 3 years old, their gender identity is established. And they start to they start to connect more with the parent at the same sex of them. Cognitive development. So we're going to move from the sensor motor stage, where they're just touching everything to learn about it, into the pre-operational stage. And that usually happens between 19 and 24 months. The concept of object permanence becomes developed during this time frame as well. And toddlers are able to articulate memories that happened to them in the past. So we want to be careful about what these toddlers are experiencing. Also, what they hear as parents, what the parents are saying to them. My oldest, when I think she was 14 months old, she went into my parents' house with my mom, and my mom spilt almost a whole gallon of red paint all over the place. And my daughter, for probably 3 years after that, refused to go under the house because she remembered that there was red paint all over the place. And this is my severe anxiety child. So she had associated the red paint with blood, and she just straight up refused. And she was only 14 months old when that happened, and she could tell us so many details about it. So it is pretty amazing what they retain and what they're able to re-articulate from a memory. And we're going to see them start to play house and mimic roles at this time. So they'll start to mimic gender roles, in addition to playing out roles of a doctor, or of an office worker, or of a mom cooking in the kitchen, or a dad cooking in the kitchen, and things of that nature. And then you do again see that gender separation, where the boys take on more masculine roles and the females take on more feminine roles. So the pre-operational thought does not allow the toddlers to understand other viewpoints either. So we're kind of back to the egocentric. It does, however, allow them to symbolize objects and people with previously seen activities. So they have an ability to associate. They just don't have an ability to understand somebody else's point of view. And this is the point in time also where parents start to get all of those really fun questions. Why? How? Why? How? And it can be exhausting to answer those questions over and over and over again. So parents need to decide how they're going to cope with that and how they're going to answer those questions. I am constantly saying, that's not a why question, bud. After my little one will ask me, well, what is that? I say, oh, well, honey, it's a printer. Why? Well, I don't know. That's what it's called. And it just keeps going. Why? How? Why? How? So we're going to warn parents about that, and make sure they just have a kind of a standard answer that they're able to give once they've exhausted the actual answer to the question, if there is even a question there. But this is the toddlers just exploring their environment. They're so curious about how everything works and what's around them, essentially. So when we're looking at language development, if you remember those, by the end of 1 year, the infant should have between 3 and 5 words at 1 year old. And by the end of 2, the infant should have between 200 and 300 words. So they are starting to truly develop a significant language. We can see them start using 2 to 3 word sentences by about 2, and by 3 they're combining several words to get simple sentences going as well. And so we're now going to move on to discussing spiritual development. So spiritual development really parallels cognitive development, because the ability to think outside of oneself, as needed with spiritual development, comes along with that cognitive development. The family and the environment that the child is raised in has a strong influence on the child's perception of the world and of the spirituality. Routines such as saying prayers before bedtime, prayers before mealtime, become very important to the toddler. And although they might not understand the reason behind it, or what is really happening in the situation, the toddlers really enjoy that, and they will be the one to demand it sometimes. There's a great project that was done. It's called Fowler's Faith Construct, and it looks at the various stages of faith in childhood. So if you have curiosity about that, you can look at that, the Fowler's Faith Construct. So again, for growth and development, take a look at that table on 32-1, and we're going to talk about a few of the aspects associated with that. Too far, sorry. Okay, so under growth and development, we're going to talk about body image. So they're able to recognize different genders, as we stated earlier, by 2. So they can recognize that little boys notice that they're different from little girls. And they might not have the language yet to articulate that, but they realize that there is a difference. They will refer to their body parts by name. So if the parents want them to use proper terminology, such as penis and vagina, then they need to be utilizing that terminology. If you call it a hoo-ha, your child's going to call it a hoo-ha. So we just need to let parents know that whatever they choose is fine. It's personal preference, but whatever language they utilize, that's what their child is going to start utilizing as well. We also want parents to be very careful about using negative terminology to describe physical appearance, because children will start to internalize that terminology, and they will repeat it as well. So utilizing we want our children to grow up with a positive body image, and so we need to keep the language positive even as early as toddlerhood. We don't want them to think of their private areas as dirty or as wrong or anything like that. There might be some times, and I think we talked about this a little later too, but toddlers will start to touch and feel themselves, and instead of having a negative response to that or telling them that that's inappropriate, just redirection is the best way to handle that. So we can let them know that it's not okay to be touching themselves in public, and that if they want to explore their bodies in private, that's more appropriate. Or you can just redirect by, say, removing the hand or just grabbing the hand and holding the hand in a loving way. And that way it's not putting a negative connotation on it, and it's still allowing for that exploration. With gender roles, again, I mentioned earlier, they'll start to be identified during play. So we'll start to see those masculine roles and those feminine roles come out. And the boys will start to identify with the father, and the females will start to identify with the mother, and will start to take on some of the roles that are differentiated within their family. These relationships at this time are incredibly important and can really impact the child's ability to develop relationships in the future. So obviously we want everybody to be able to have a healthy relationship, and during toddlerhood, the boy's ability to identify with dad and the girl's ability to identify with mom contribute to that. Now, it's not all or none, but there's a contribution to that child's ability to develop healthy relationships down the road. When we look at social development, we're going to look at, again, their separation, their social behavior, and their language development. So by this time, they can feed and dress themselves. Sometimes they need help with certain things. Taking a t-shirt off is very challenging, so that might be something they still need a little bit of help with. But for the most part, they can do these things. We want parents to understand, though, that even though their toddler can feed him or herself, they should not be leaving that toddler alone to feed themselves, because there's choking hazard associated with that. They are going to start to develop concerns for others' feelings. Now, I said earlier that they cannot distinguish between others' points of view, but they're going to start to see when somebody is sad, and they're going to walk over and pat them on the back or give them a hug. They're going to start to recognize emotions in other people. And the play is going to start to become increasingly interactive. So remember those infants, they just kind of stand back. At toddlerhood, we're going to have parallel plays. Although they're still not necessarily playing together, they are going to stand next to each other, and they're going to play with very similar toys. We're going to see some more imitation play where they dress up and play fireman, police officer, things of that nature. And again, they really enjoy that tactile play. So anything they can touch and feel and manipulate is going to help them to learn a lot more about their environment. So when we're thinking about that, we want to make sure that parents understand they need to select appropriate toys for the home based on their child's age. So tiny little Legos is not the most appropriate toy for toddlers from 1 to 3 to be playing with. Although they're nice and tactile, we want the nice big ones for them to play with so that they can't choke on them, right? Now moving on. So some concerns related to normal growth and development. Toilet training. Every parent's worst nightmare, potentially. Most parents dread toilet training just because I believe it can be fairly challenging. And it's a major task for toddlerhood. And as long as parents wait until their toddler is ready, it's typically not as challenging as parents think. It's one of those things that's gotten a bad rap, but isn't all that bad. So we want to guide the parents to watch out for some signs that their child might be ready for toilet training. If the child wakes up in the middle of the night or from a nap and still has a dry diaper, that's one sign. If they're aware, so if they say, "Hey mom, I have to go pee," or if they say pee 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 and they're going pee, then that's another sign that they might be ready. That's both communicating the need to go and then also noticing the urge to go. And then being dry for at least 2 hours, just consistently, because as their bladder gets bigger and their sphincter becomes more developed, they're able to hold the urine a little bit longer. And so if they're able to be dry for 2 hours, that's a good sign also that they are about ready for that toilet training. There's a whole bunch of different approaches, and I'm sure every parent can tell you a different story. So overall, there's not one single recommendation. It's kind of just see what happens with the child and if they're ready, they will do it. In children without any sort of cognitive delay, they don't go to kindergarten in diapers, so it's okay. And sibling rivalry is a very normal aspect of growth and development. So especially when those newborn babies come home, it's natural for siblings to be jealous and resentful of one another. And it comes down to the parents' attention. And even if the parents are splitting their attention or giving everybody tons of attention, there's still going to be a little bit of sibling rivalry. Some of that contributes to when there is a new baby brought to the home, because there's a disruption in that toddler's routine. And toddlerhood is, generally speaking, the time that a new baby is going to come into the home. And so parents just need to be aware that the toddler is probably going to have a little bit of regression when that baby comes into the home, that they're going to potentially throw a few more temper tantrums, and they're not going to truly understand that that baby's here to stay. They may make comments like, "Oh, the baby can go back in mommy's tummy," or "When is somebody coming to get the baby?" and things of that nature. So helping them transition through that, it just takes some time and some gentle guidance that, no, this baby's here to stay. This is your little brother or sister. And having them participate in the care is usually a great way to bridge that time when they're getting used to the idea of, oh crap, this little human's here to stay and mom and dad have to pay a little bit more attention to it, and I'm not getting all the attention anymore. So if we let the toddler come help change the diaper or help feed the baby, those types of things really assist in getting past at least that initial period of the sibling rivalry when the newborn's brought home. We do need to make sure that parents are communicating realistically, especially when mom's still pregnant. So instead of saying, oh, you'll have somebody new to play with, the toddler is going to take that literally, like, okay, now I have a new baby doll to play with type of thing. But we want it to be a realistic, well, we're going to bring home the baby. Babies can't play yet, but eventually there will be a playmate. So we want them to understand that this little newborn is not their playmate. And making that clear is also very important during this time period. We've talked a little bit about temper tantrums, but the key to understanding a temper tantrum is understanding that it's the assertion of independence. It does not have to do with the child trying to make the parent's life miserable. And I think that that's the important aspect to communicate to parents, is that they are not doing this to upset you. They are doing this as an assertion of their independence and their objection to their discipline. The parent's response is going to affect how often the temper tantrums happen and how severe they are. Now, the child's temperament always plays a role in this, so there's never a one-size-fits-all solution, and sometimes the parents can deal with it perfectly and the child's still going to throw tons of temper tantrums and they're going to be horrendous. So there are some guidelines that we can provide. So if serious temper tantrums it can be serious if temper tantrums persist past 5 years old, if they last more than 15 minutes, or if they have more than 5 a day. So if those things are occurring, then we're going to want to refer these individuals to a different level of care so that they can see if there's some underlying psychological problems that need to be dealt with, or there might be some underlying medical problems that are causing pain for this individual. So we're going to want to elevate their level of care. So again, that was past 5 years old, lasting more than 15 minutes, and more than 5 in a day. But what we can educate our parents to do is to stay calm, but completely ignore the behavior. We want the parent to stay present so they can walk away from the toddler as long as the toddler knows that they're still there. So they need to kind of be within visual range, but not interacting with the toddler. So those are ways to deal with it when it's happening. Ignore it. And unfortunately, they can last for a little bit, and especially when you're out in public, that feels horrendous to have your kid throwing an absolute fit. But starting off by giving them a hug, saying, I love you, and I'll be right over here when you're all done with this. That's the best way to deal with it, and you walk over and you ignore them as much as possible. And we want to make sure that they still feel safe, though, so that's why you have to stay within a visual field of the toddler. To avoid temper tantrums, we're going to try to give them choices. So if we want the toddler to they're starting to get ready for bed. So we can say, okay, Joey, it's time for bed. Would you like to brush your teeth first or put your pajamas on first? That gives them a sense of control over their environment and over what they have going on. So they're less likely to throw a temper tantrum and more likely just to pick one of the choices. We don't want to give them yes or no questions. So similar to the way we're going to talk to our patients, we want open-ended or choice questions. So we want to know, do you want to brush your teeth or do you want to put your pajamas on first? Not, hey, Joey, do you want to brush your teeth? No is going to be his answer every single time. So it's not an option of whether or not you're going to do it. It's an option of what order you're going to do things in first. And again, we want to go back to praising that child for the positive behavior, because that positive reinforcement is going to go really far during this time. We also want to address consistency in response. So if the child is cared for by a multitude of different caregivers, we want to make sure that the caregivers are all responding to the child in the same way so that they can expect a standard response when they are behaving in a certain way. Back to the negativism. So again, toddlers' initial response to most things is going to be no. And that's for two reasons, really. One reason is because they hear it a lot. No, don't touch that. No, we're not going there. No, you can't have that candy. No, you can't have that. So no, you can't. Stop touching your sister's toys. So they're hearing no a lot. So they think they should say no a lot. Remember, they're imitating what it is that their parents are doing and saying to them. But another aspect of it has to do with them asserting their individuality. So if we're asking them to do something, they're going to say no because that's an assertion of, no, I'm different and you can't make me. But again, like I used the example of my little guy and his never. And that's the way he says it. It's hilarious. But he says that, and then he moves on to doing the task that I've asked him to do, usually within 30 seconds. So it's his way of saying, you can't really make me, Mom, but I know I'm supposed to do this and I'm going to do it anyways. So in a nursing environment, one of the things that we want to, again, go with is instead of asking, can I listen to your heart, which is going to get you a big fat no, you're going to make a statement. I'm going to listen to your heart. And again, we want to show them the stethoscope and let them touch it and play with it for a little bit if they want to. But having it be a statement as opposed to a question will get you a lot further with that child. I mentioned regression a little bit with the sibling rivalry when a newborn comes home. Again, we might see a child who's given up the bottle want the bottle all of a sudden because the baby has the bottle or the pacifier or things of that nature. And there's periods of time where regression is a normal occurrence and it's an expected occurrence. When that newborn comes home is one of those times. Another time that we expect regression is when a child is unable to, when they have a lot going on. So it occurs specifically during times of stress and discomfort, and it conserves their psychic energy. So if they're stressed out or uncomfortable for whatever reason, their brain is dealing with all of that, and it's hard for them to try to maintain the achievement of new tasks in addition to coping with the stress. So we might see some regression. We can deal with it just by ignoring the patterns of regression and praising when they do something new. We want to be careful, though, that if we know a child is under a lot of stress, if they experience some sort of traumatic event or something that we know that this is going on, we want to be careful about forcing them to learn new tasks at that time. We want to make things really simple for them because, again, their brain is trying to cope with the stress of the situation and doesn't have the capacity to cope with that in addition to learn all these new tasks. And toddlers are learning new tasks at an incredibly rapid rate every single day. So we just want to keep that in mind. Regression might also be a sign that something stressful is going on. So if the child is in preschool, or it's not preschool quite yet, but a child care facility or goes to a daycare, then we might want to explore that a little bit if there is some sort of regression that's occurring. So how do we promote optimal health during toddlerhood? We're going to look at a toddler's nutrition. We want to keep in mind that lifetime eating habits can be established during toddlerhood. And also remember, these are little picky eaters. So we don't want parents to give in to the picky eater. I know I had a friend one time say, my child will only eat things white. well, there's zero nutrition in things white for the most part, right? Cauliflower, I guess. There's a few things here and there, but we want to offer a rainbow all the time of foods, and especially during this time of toddlerhood. So even though they're going to push it away, they might even throw that plate across the room, we're going to offer a huge variety so that they can see that these things aren't quite as scary as they think they are. The serving size for a toddler should be about 1 tablespoon for every year of life, or you can also look at it from the adult portion perspective, so about 1/4 to 1/3 of the adult portion is what a toddler should be eating. We want our parents to be aware of choking hazards. So hot dogs are a big choking hazard, grapes, cherries, things that that can lodge in those throats. So we're going to recommend that parents cut hot dogs in half lengthwise as opposed to cutting them into bite-sized pieces, cut grapes in half, and just have an awareness of the child's ability to chew and eat. And we also want to promote that parents go out and they take a pediatric CPR class. You know, they don't have to be PALS certified, but just having that infant pediatric CPR is really important. I can't even count the number of times I've had to do a modified Heimlich on kids, not just my own. There's been kids in the park. I mean, my neighbor's kids, and I've had to flip over and smack my own kids on the back numerous times. So kids choke on things, and that's, again, we want those parents, somebody sitting there with the child while they eat, and then we want to prevent it as much as possible. But knowing what to do in that situation allows the parents to stay calm to actually deal with the situation if we do have some choking going on. We don't want to force kids to eat food because that's going to provide a negative connotation to food. So a better approach is just to constantly offer a variety of food, not force them to eat all of their food. Forcing them to try something is okay, and then they can make up their mind whether they like it or not like it, and go from there. But we definitely don't want parents forcing their children to eat all of the food on their plate, because that's just going to develop eating problems in the future. And as always, you want to encourage a diet of fresh foods and well-balanced. We have, as you well know, epidemic of obesity in the US specifically, and we are seeing the effects of all of the processed food. So having as much fresh food available to our parents as possible is very important. And there's so many great resources out there for parents who have a lower income for them to be able to obtain these foods to give to their children. Children who are active, who are playing, are going to have a tougher time transitioning to sit down and eat dinner. So if a parent's complaining about a child who won't sit still for dinner, then they need a little bit of a transition time from their playtime to their dinner time. So that might be sitting and having a little bit of a book with a parent, or coming in to help with dinner, or setting the table, or even just sitting at the table and providing a few little healthy snacks like some carrot sticks or celery sticks or something like that, so that they're able to have that a little bit of a transition period so they can sit in longer for to eat their actual food. And I know this is a problem for a lot of parents with toddlers, to where they have these little grazers who they will not sit and eat, and they just want to be up and moving around all the time. And each parent is going to deal with that just a little bit different. But if we provide them that transition time, they're more likely to sit and stay at the dinner table, at least for the period of time that they're eating. There's some great details in your book about specific nutrition, like what level of vitamins they should have and how many calories and all that stuff. So if you want more information, you can take a look at that. It does have some really good information there. And a lot of parents like to use complementary and alternative medicines, such as homeopathics, and even essential oils fall into this, chiropractic care, acupuncture care. Those are all great uses of the medical sciences. And we just want them to discuss some of these cares with their physicians, because there can be some interactions, especially if their children are on any sort of pharmacological medication, because there can be interactions with some of the alternative medicines and herbs and supplements and the medications that the child is currently on. So it's encouraged, but we want their primary care physician to be aware of what other alternatives are they utilizing, so that they can make sure to integrate appropriately. Sleep and activity. So toddlers should sleep about 11 to 12 hours per day, including one nap. So they'll usually sleep about 10 hours at night and nap for about 2 hours. During this time, from about 1 to 3, a lot of kids give up their nap, and that's okay. And they just need to make up that sleep at nighttime. We're going to see a lot of resistance to bedtime. They don't want to stop what they're doing, and they're scared they're going to miss out on something. And they also start to develop this amazing imagination at this time. And when that happens, we see a lot of fears come to light. So parents need to address these fears and comfort the child, let them know it's okay to be scared, but there's nothing to be scared of. Some parents will use a monster spray or, something fun and make a game out of it to transition the child through this period. And that's okay. They're experiencing this whole new ability to imagine, and to their cognitive ability is growing so rapidly that all of these fears are coming to light now, because they can see past their immediate environment. And so it's fun to listen to what they have to say, but then the fears can be kind of frustrating, especially at bedtime, as they just want the parent with them. And that's hard. You want to lay a child down and have them go to sleep, and they can't always do that. So sometimes we need to provide a little bit of transition for them. Parents who maintain a regular bedtime routine, and bedtime time are going to have far more success at getting their old toddlers to go to bed. So encouraging just, bedtime's at X time, give or take, and this is what we do. We brush our teeth, we comb our hair, we put our pajamas on, get into bed, we read a book, we sing a song, we say a prayer, whatever it might be. But having that consistency is key to having a successful bedtime for these little ones. Dental health. So we discussed this a little bit in the infant lecture, but remember, those teeth are erupting, and once they're 1 year old, we want them to have an established dentist, and we want them to be seeing that dentist however often the dentist recommends. We want them flossing and brushing, and the parents need to do this. So up until probably about 4 or 5, the parents need to participate actively in the dental care. The children just don't have the physical dexterity or the mental capability to focus on what needs to be done to keep those teeth nice and clean. We want kids brushing their teeth ideally after meals and at bedtime, and then not having anything to drink that has any sort of caloric attributes to it. So no milk, no juice after those teeth have been brushed. We're going to start to use fluoride, and a lot of our water is fortified with fluoride, but that just helps to prevent cavities and to strengthen the teeth. And again, we don't want to put no bottles to bed. The food that we are offering these toddlers, we want to make sure that it's not very high in sugar, that it's not all this gummy candy that's going to stick to their teeth. We want food that's healthy for them. Healthy nutrition is going to contribute to a healthy mouth as well. And the mouth contributes to the whole entire body. So having a good dental routine early on is really important for these little ones. And safety promotion and injury prevention is a huge topic with toddlers. And I've discussed a few things here and there, but they're at risk for a number of different things. They're at risk for aspiration of foreign objects. Remember, everything's going in the mouth. That's how they're exploring with all 5 of their senses. So things are going in the mouth. They're at risk for bodily harm, especially for riding bikes or climbing on play structures, climbing on bookcases that are going to fall over on them. anything, climbing up the counter to the microwave to the refrigerator to get some candy, right? So they just go. They don't understand the consequences of their actions. So we need to make sure they're in appropriate and safe environments. Burns are common during this time, hot water and from the fire. Again, they don't know that things are hot, so they just touch it. And remember, they're touching and feeling everything. Drowning, unfortunately, is common. These little ones typically don't know how to swim yet, so we want to make sure that our parents are practicing pool safety. So always having somebody watch, make sure if they have a pool that it's adequately fenced, and that we just have adequate supervision of the toddlers during this time. Falls are very common. I kind of mentioned that earlier. Motor vehicle injuries, you want to make sure they're still rear facing until 2, and that through the toddlerhood that they're still in that 5-point harness to keep them safe in the car when driving. Toddlers spend a lot of time in the car, so making sure that they're safe there is important. And poisoning, again, everything goes in the mouth. So if they get a hold of medications or cleaning supplies and drink them, then they're in trouble. And suffocation, so plastic bags over the head, or just getting smothered under their blankets and things of that nature. So just providing parents with all of this information is imperative to the health and safety of the toddler. And then we're going to look at anticipatory guidance. So what type of problems can we anticipate and what can we do about them? In your book, and the current copy, the 6th edition, it's on page 901 and 902, but it's called the Family Centered Care Box. It goes over all of the different things that should be addressed in anticipatory guidance. And one of the things that we can do is we can provide home visits. So telling a person that they need to lock all their cabinets is one thing. Having somebody go into the home and physically identify all of the risks that are there, and then giving them the supplies to fix those problems right then and there is going to be far more effective than just saying, hey, all your cabinets need to be locked, your bookcases need to be attached to the wall. So in areas where we see a need and we're able to provide that level of intervention, that's going to be our best case scenario. We want parents also to express their feelings about what's going on. This is not an easy time to get through. Parenting is hard, and we want them to have either their own support. So do they have a support system in place? Do they have a family member or friends that they go to and they can all talk about what's going on with their toddlers? Or they can express it to you as the nurse, and you might hear some things, especially parents who are dealing with some of those difficult temperament children and what they're going through, and give them some guidance in that this is normal and it sucks, but it's okay, and you'll get through it. So being open to allowing parents to express their emotions with you is really good, and it might actually give you the opportunity to identify some problems early on before they become serious problems. So up next, we're gonna learn a little bit more about preschoolers, but take a break. It'll be a separate lecture.